Cancer treatment can be a rough and tiring process, and moving on after treatment can require support. We're happy to welcome back Stacy Jones with the OSU Extension and Dr. Ashley Braun with OU to talk about a program that the schools have come together to develop to help patients. Welcome in. Thanks for being here today. Dr. Braun, let's start with you. What does this program look like? How did it come to be? And how does it look maybe different than other programs similar to that for cancer survivor support?
Yeah, thank you. So the origin of this program came from the fact that there's often an absence of holistic or comprehensive programs for people in the community that have just finished cancer treatment, because we see that, health systems and the scientific community are very good at diagnosing and treating cancer, but then when the cancer is gone, you're just sort of left to your own devices.
Then what?
Right. And that can be a very taxing and challenging process to go through. And so what we find is that survivors are often, they're sort of generating their own approaches. So maybe they're seeking a community of survivors through their faith-based community, which is wonderful. Or they're using programs that maybe aren't designed for cancer survivors, and they're just kind of making it work to the best of their ability. But maybe it's only targeting one thing, or maybe it's targeting physical activity, or maybe it's targeting just peer support, but it's not targeting all of the factors that we see influencing trajectory of health after completing cancer treatment. So that's what we're seeking to do. And diving into this, you guys are doing a small study, a 6-week study where you're looking into this and asking for participants. Stacy, what's that going to look like, and who are you looking to find, and how will it work?
So who we're looking to find is, we are obviously looking for people who have already gone through the cancer treatment process. And they're on their journey to recovery. It's going to be 6 weeks. It's going to start on September the 17th. It's going to be at OSU Tulsa. So we're going to cover a variety of subjects, such as physical activity, nutrition, mental health, resources, financial planning, and basically continued care of these participants. And basically what we're looking at is, this is actually developed from survivors for survivors, and that's what we want to continue to focus on.
So these would be 6 weeks, weekly check-ins?
In person.
Dr. Braun, I think people often overlook the after treatment. Real quickly, what are some things that maybe people don't realize that people who have gone through cancer treatment need support on?
Yeah, I think a quote from an individual that I interacted with best represents this, and they said to me that being sick with cancer was easier than navigating survivorship, because it's complicated. It's a little bit different for everybody. So sometimes they don't know what they should be eating. They don't know how they can start to exercise again, because maybe they have persistent side effects. They want to hear from other survivors who can share their lived experiences. They are trying to recover financially, because cancer treatment is very expensive. So it's a multitude of factors that are all kind of convening together to create just a complex combination of needs that aren't well addressed with what we currently have to offer.
All right, well, thank you both for being here. We really appreciate it. Great work.